Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old female with complaints of knee pain. There's been no prior injury, no sports activity, just pain for the past couple months. And we see here on this axial image that she has a collection of fluid in the middle of the knee. So this is the kneecap in the front, this is the back, the popliteal area, and right in the middle, this is the femur, this is the intercondylar notch between the medial and lateral condyles. We see this white thing here. This is a fluid collection intimately involved with the ACL. So if we put up a sagittal view, basically a side view, we can see the kneecap here on the left. We see the femur here. We see the tibia down below. Now we're going to find that ACL. So this is the anterior cruciate ligament. It comes obliquely from the back of the femur to the front of the tibia. It limits the tibia from moving anteriorly. And we can see that behind it, intimately involved, is this lobulated septated fluid collection. If we put up this view, now fluid is really white here. We can see it stand out. This is a cyst arising from the ACL. So we call this an ACL cyst, which is really just a ganglion cyst that is coming off of the ACL sheath. It may be that the synovium is herniated through the ACL sheath and the fluid is back here. In some patients, the ACL will also be foggy, and if you see fluid collection there, you think it may be related to maybe mucinous or mucoid degeneration of the ACL and fluid, this mucinous material coming from that. But in this case, the ACL looks so clean and nice. It's probably just a ganglion cyst from the synovium herniating out. But this is not uncommon, seen in about 1% of people, and oftentimes the patients are asymptomatic. Other times they will have symptoms of fullness in the knee. They have difficulty extending all the way. In this patient, there was no prior injury and no other significant findings, so likely this is the cause of the knee pain that's been going on for a couple months. I've been told by some orthopedic surgeons you don't really have to treat these, but if the symptoms are really bad, then they can go in arthroscopically and just to make a slice in them and let the fluid drain out, and they get instant relief of the symptoms. You can also do CT or ultrasound guided drainages, where they put a needle in there and suck out the fluid, and supposedly those work pretty well too, though they can reoccur. But this is again just a nice straightforward case of an ACL cyst, ganglion cyst of the ACL, and there it is. Thank you so much.